Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with a special lady, Suzanne, who had a condition that I didn't realize you had it for a really long time. Because often people resolve themselves is they're going to have chronic headaches, nobody can get rid of it. So after a certain period of time, it's common for people to give up. But for some reason, with your condition, you just decided not to give up. And I thought it would be neat for you to share a little bit of your story and how you ended up here.
I had a real bad, stressful summer. And I noticed stress seems to aggravate it.
Yeah, why don't you explain your condition?
I have, brachioradial pruritis is what I looked. I had to Google search it because I went to doctors, dermatologists, and they just kind of
just said horrible itching.
They said old age.
Okay, but horrible itching.
Itching from the top of my shoulders to my wrists, nothing on my hands.
Like all the time?
All the time, worse at night. The only way to sleep was with ice packs.
Okay, and how long had you been doing that?
Well, that was kind of a memory thing for me because the ice packs had been probably 5 years.
Okay.
When I started talking to people in my life about this itching, they were reminding me I'd been doing it for 20 years.
Yeah, that's what I mean. So
yeah.
You could see where somebody who has something for 20 years, you're not going to search anymore.
Right.
But you were still searching, for an answer.
I went through a bad period with stress and sun. And I moved to Oklahoma, and we live on a lake, and we have a boat.
Okay.
So I'm stressed from my mother's illness, and then I started ripping my arms until they bled.
Both arms or just
both arms?
Okay.
Both arms. Rarely at the same time.
Okay.
It would be one arm, and then it'd be another arm. And people would grab my hands, and because I didn't even realize I did it anymore. They would try and stop me, why are you doing that? And till I bled. So I Google searched, I found radial brachial pruritis, and it literally said that it was pinching of nerves between C3 and C5. So I was talking to chiropractors, they're never heard of it. Then I saw your website talking about prolotherapy. I called 6 prolotherapy technicians in Orange County. I sent them emails, talked about the condition, and not one of them looked it up. They all called me back and said, well, I can adjust your upper cervical spine. Mm-hmm. I've never heard of using prolotherapy for this. And I was really kind of outraged that they didn't even look it up, and try.
Okay. Yes.
So then I went to your website, found 2 testimonials of women who you could have put my face on their interviews. Their life was miserable. So I showed my husband, and he said, book it. We're going. And that's how I ended up here.
And then, okay, so what did we find on the first visit, and then what was your response? You're here for treatment number 3, so it's
right.
Literally I've only seen you twice before, right. And this is the 3rd time.
The neck therapy, I believe, is having a big impact. But seeing the X-rays and seeing the movement, pinching those nerves,
right. Pinching
where those nerves go,
exactly.
It all matched up and made sense. So
the motion scan showed that you actually did have some nerve irritation.
Yes.
Usually nerve irritation gives pain, but in a very small percentage of people it gives tingling, burning, and eventually itching.
That was the thing I had trouble explaining to people. I said, it's not like a mosquito bite. It's like my bones itch and they're on fire.
Yeah.
So it was a total different itch than I'd ever felt before. But I don't know that they cared. I don't think they took the time. They wanted to put me on gabapentin. They want to put me on tranquilizers. You
obviously at some point probably tried all those things and they really
didn't do anything.
Okay.
Yeah.
Okay. So
Benadryl, none of that.
So you get the crazy 70 shots in your neck from Dr. Hauser.
And the really changing my posture.
Yeah.
I also had my arms go numb at night, so that would wake me up as well. So I don't have that anymore, which that is really nice as well.
So you're sleeping better.
So I'm sleeping better. I'm not waking up with just totally, dead hands. But I'm doing my 50% that you told me I had to do.
Yeah, exactly.
I am doing my exercises. I am focusing on my posture.
Yeah, and then, so tell everybody, so kind of like awful, like how are you doing now after like 2 or 3 months?
No, I'm like better.
Drastically better.
Occasionally I have post-traumatic stress when I get a little itch on my arm, but it's just
You actually have
nothing.
times where it doesn't even itch, right?
No, most of the time. It's just very
Isn't that amazing?
occasional.
Like,
Yeah.
that's like a miracle.
Yeah.
It's like, you
Yeah.
probably never thought it would ever go away.
I didn't. I was resigned that this was going to be my life, and that was depressing. That was really depressing, especially this last summer. I had to wear a shirt every time I was in the sun, and I'd have to hide in the little shade of our boat, and it just made it not enjoyable, you know. So,
Yeah, and that puts a strain on, your husband relationships and family relationships.
Yeah,
So
no.
he's got to be happy. Like, he got his wife back.
Yes, he is. He is. And so he was lucky for me, the big kind of push. No, you got to go. You got to go.
And we hadn't planned to do this interview. It's just you were in my office, and I had a patient yesterday, and I was hopeful they were going to be here today because I just did an initial consult. Because I could tell the patient had it for like 20 years.
Yeah.
So I was hopeful they were here today, but they're not here today. And then I thought to myself, geez, I wonder if even after our consult, because they had it for so long, they don't want to be disappointed. Because that there's people that struggle with, why try another thing? I tried 60 different things, but you would admit, like, prolotherapy is so different. It's so other. Like this is inflammatory. And then I'm going to teach you something that you probably never heard about. It's called Hauser's Law. So I just want to explain Hauser's Law. So I have done videos on it. So there is a video on Hauser's Law. And then I'm about ready to write a scientific paper on Hauser's Law. But it's basically this, that if you have a symptom or a condition or a diagnosis, but the cause of it remains elusive, if you follow the neurology will lead to ligamentous joint instability. So if you had pruritis or itching in your legs, not your arms, then if you followed the neurology, of course the neurology would likely lead to like the sciatic nerve, which leads to the lower back or the pelvis. So it's probably you have ligamentous lumbar instability. But in your case, it led to like the middle, not the upper, but the middle of your neck, ligamentous joint instability. Then if you treat that, you correct that, the symptom, the condition, or the diagnosis gets resolved.
In reading I was waiting for my appointment. I was going through your YouTubes, and I had burnt tongue and mouth, which I've gone to doctors with the explanation, and they gave me certain mouthwash, prescription things, and then I saw that on your website, and I just cried. I was like, I've been searching for years.
No, did that symptom, I mean, we haven't talked about that. You're saying that you got resolution of that. So burning.
When it said right there, C1, C2, I was like, why? Why is this not common knowledge?
Okay, so explain that symptom since we're talking.
And I feel like it wasn't gradual. One day I just felt like you feel after you eat a French fry that
like it's
fries
hot.
Your mouth, and then everything just burns. Every time you put food in your mouth, it burns.
The whole mouth, not just the tongue.
The roof of the mouth,
everything.
the tongue, everything.
Okay.
And I was just told, again, to live with it. And then seeing that, it was just kind of...
confirmation that you should come here.
It's a sad confirmation that nobody else knows this and I feel like there's a lot of stuff with women. I'm 66 and I'm in the medical field.
Yeah, what do you do?
I'm a midwife.
Okay. Awesome. Thank you for doing that.
Oh, I love it. But in obstetric care, the doctors are like, no, it's normal to have a backache. You're pregnant. What do you expect?
Okay.
And for me, I treat the symptoms. No, I actually pre-treat it so they don't get the symptoms. It's just a whole different mindset.
God, that must have, it's always, I always feel sad for like a healthcare provider who, like, here you're in like holistic care. Like, what could be more holistic than a midwife?
And you can't,
and then you can't cure yourself.
Yeah.
So I could, God, that would have been,
you know, they
hard
rather wait for pathology and then treat pathology with pills,
the symptoms,
instead of doing the things
Yeah.
so that we don't have the problem in the first place. So my neck, I didn't realize focusing on my neck was going to also be a big part of this. Like you had said in the beginning, 50-50, I have to do my part.
Yeah, because I can't correct your curve.
Yeah.
I can
help
get rid of the instability, you know, give some foundation to the structures. What percentage would you say the burning mouth is? Like, what percent better is it?
Oh, it's
80% better?
virtually gone.
Okay, virtually,
virtually gone.
So you're almost virtually gone.
Yeah.
Okay.
And to mention, I did have a really bad car accident, like 25
that might have
years ago.
That might have started the process,
with
and then
bad
of course
whiplash.
Then it's only been 23 years that we got cell phones. You know, like everybody
Yeah,
got the Apple cell phone, so it's been, and you can understand all the structural damage from the cell phone. It is going to take some time.
Yeah.
So I just think now we're starting to see, like, it's been 20 years that everybody's been looking down at a cell phone.
I've been holding my phone up. I bought a thing for my laptop to raise it. I'm really
no, good.
focusing.
You went all in.
Yeah, well,
you went all in.
No point in doing all this and not going all in.
So what would you say to somebody who's had something for so long and they're just getting hopeless? Like, well,
the last few months of crying, laying in bed, not sleeping with ice packs was, it works on your psyche.
Yeah.
Like, do it. You have to try it. You have to try it.
Well, just keep searching. Like, you know, it isn't like every single person got to come here, but just keep, there's always a cause for something.
Good luck searching. I searched.
Okay, but there's always a cause. There's always a cause. So, again, if somebody's struggling a lot, even if it's for many, many years, it's like there is a cause. So sometimes ligamentous joint instability is the cause, and then the test to document it is you have to do some kind of motion test. Like, do some kind of motion test, whether it's a motion test for your lower back, like a motion x-ray, or your neck, and then normally that will reveal the ligamentous.
But it makes sense. I had an MRI. I had CTs.
Yeah, but you were laying.
And you're staying still, and they're
Right,
like, there's
staying
nothing
still.
wrong with you.
And then a lot of people don't realize almost all the ligaments of the body, they don't show up so good on MRI or CT scan.
Yeah.
So.
And that's what they use.
Right, but the movement of bones, so if bones move excessively, it means the connectors of the bones, the ligaments, they're stretched out, damaged, torn. And one term I use a lot is you have ligament dysfunction, like the ligaments aren't holding the bones together. So then the bones are going to move in ways that God never intended that bone to move. You know, whether it's pinching a nerve in your arm, pinching the vagus nerve, obstructing the jugular vein. So just out of curiosity, you know how, like, on the YouTubes that I do, a lot of times I talk about the jugular vein. So did you have any of those symptoms where you had head pressure or eye pain or brain fog? But nothing.
Nothing.
Okay.
Brain fog, yes.
Yeah, so, because, you know, a lot of times, the interesting thing about what you do and I do, like, you know, when you help prevent a pregnant gal from getting back pain, the side effect of it is she'll tell you, oh, so many other things are better with her. That's why I like natural medicine, because you could come here for like you come here for burning, itching arms, but in the end, you could say, like, gosh, mentally I'm better, my cognitive function's better. So did that kind of came back too? Like, you're starting to...
It's still coming back.
Okay.
But just, I worked with a chiropractor. I shared an office with her.
Okay.
So it's not like I wasn't getting adjustments. I was getting adjustments quite often.
Okay.
It wasn't enough. I mean,
when it would help temporarily.
When I showed her your program, she literally said, "This makes sense.
Oh, good.
You have to do it."
That's good.
So that was a huge testimony, because she's a very...
Well, and you know what we do here is very scientific. Like, we take actual, measurements of things that are now part of your chart. And then if you need a fourth visit, we'll talk about it. Today's the third visit.
Well, I showed her your x-rays.
But I mean, on the fourth visit, that's
she's
when...
like, That was it. She's like,
Okay.
you got to do this.
No,
So
that's
that was
great.
reassuring to me too.
Great. No, just appreciate you telling your story, and I'm sure it's going to help a
If
lot
I
of
could
people.
help one woman, because I was in my deepest, darkest place before I came here.
Okay. Yeah, you look like totally healthy now.
I feel better. I feel better. But I'm working on it. It's not, it's not,
Yeah.
you still have to work on it every day.
Yeah, exactly. And then, like I tell people, like on their last visit, or what I hope is their last visit, I say that as long as you maintain your neck curve, it's likely I won't ever have to
Yeah.
see you again. So it's always sad for me. I always feel like I'm getting divorced every day.
Well,
like
I'm getting older.
people.
I'm not ever going to agree to need surgery without at
Yeah.
least trying something out, you
Yeah.
know?
Yeah. No, I'm 61 now too. It's I don't even know what you're supposed to feel like as over the age of 60,
Well, you're
Like
a lot more active than I am.
Okay.
I got to get into
But
that.
you're going to probably get, you probably, now that you don't have this, like
Yeah.
it's probably amazing. Like you probably end up doing a lot of stuff you never
Well,
thought
you
you'd
don't
do.
sleep all night because you're itching.
Okay.
It affects
Then
the
you
whole
got
next
tired.
day. So, yeah,
Okay.
we're working on all that.
Thanks again for
Thank you.
sharing your story.
Yeah, I hope it works for other people.